it's saying it's working, it's just not showing up. So, typical.
Actually turned on though from this side.
I mean, it is on, everything's on.
Typical government says it's working, not actually working.
Got one.
Parents at work.
Got one.
I know, right?
The other one too.
This place may catch on fire if it, shoots at once.
That one's working?
Threshold.
That's usually the one that doesn't work.
I know.
Yeah.
And now the other one doesn't want to do an input.
I forgot, yeah.
Oh, wait,
Oh!
It's not on here.
All right, I'm getting your seat, it's 5 o'clock.
I'm not sure what
Oh,
screen
gotcha.
device is.
Okay,
You
so
know, yeah.
I probably got one of the adapters, it'll still run into like 5.
Well, it's only one input.
You ready, Adam?
Yep, you're good.
All right,
Where to go with it?
I'm calling this meeting to order at 5 o'clock p.m. Please stand and join us in saying the pledge.
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
All right, we have 5 out of 5 board members here, so we have a quorum. Certification of delivery of official notices of meetings,
Yep.
handled by Adam Licky. Has everyone had a chance to review the minutes of the regular meeting on October 25th?
Yes.
Yes. Any comments, changes? Is there a motion to approve the minutes?
I move to approve the minutes.
Motion by Dr. Rude, second. I'll make a second.
A little lackluster tonight.
That's all right, guys, that's all right. All in favor? Aye.
Aye.
Opposed? Abstentions?
I abstain.
Okay, 1 abstention. Mrs. Roman, motion carries. All right, moving on to the health district staff reports. First, we have population health.
Nothing additional to add to that one.
Okay, any questions, folks, about the population health report? I was at the trunk or treat, the sheriff's office trunk or treat. It was a really nice event, and I was glad the health department was there. There were, I think they said there was this cute 3,000. Oh yeah, you were there too.
I can see ya.
There were
We did
3,000 people overall, because I think
Yeah.
this said there was like 1,900
Yeah.
kids, but someone
Yeah,
told
that-
me there were about 3,000.
That was
people
supposed to be the
overall.
estimate was 19, and then I think, because I actually literally drove back and got more candy because they came by and said, hey, we're expecting like 3,000. I was like, I don't even have 2,000 pieces of candy.
Yeah, it was
Uh,
a lot. We made one little
Yeah.
strip, so we didn't see, but I saw the pictures of the health department's little
Yeah.
Candyland booth, and it was really cute.
Emily, our health educator, and Melissa, our nurse, did a fantastic job bringing
Yeah.
Candyland to life. The kids loved it, and we were there the entire night until they closed. It was great. The kids loved it.
It was nonstop people.
Yeah.
It was
For
packed.
hours.
I just had a question about the epidemiology about the pertussis
Yeah.
and the high volume cases in just the Amish area.
Yeah, that's when it first came out. I want to say this is back in March, April, is when we first had the problem, the outbreak, if you want to call it that. It was primarily the Amish population, unvaccinated. That was the discussion from Ohio Department of Health, was the unvaccinated population of the Amish.
Yeah.
And when I talked to the Amish gentleman, I think I brought this up in the last meeting. I talked to a couple Amish different Amish people, and they were like, "It's not killing us. It's an inconvenience, but we get over it." And I can't, it's their own personal opinion on that, and so they kind of weathered their way through it and did great. At least from discussing with them. I'm not living there with them.
Okay. Anything else on population health?
Nope.
Moving on to EH, Mr. Lark.
Apologize, I didn't have much in there this week. I was just out of action for the
Deathly
last
ill.
couple of weeks, yeah. But one thing I did want to bring up that I didn't get in there was that last month we did get to all the Amish schools, which is the first time in like 3 years, because we're supposed to do school inspections twice a year for all the schools. And so we worked with the Amish school board and their superintendents, and actually through the first 2 weeks of October, we're actually able to get back into all the Amish schools and get our inspections done and work with them to correct a couple things.
Do you know how many Amish schools there are?
I was trying to remember when I was sitting here, when I was thinking about saying that, and I can't remember, but it was, I believe there's over 60.
Oh,
It's a lot.
Yeah.
They've
I
popped up
wasn't
a couple
expecting that
more.
response.
Yeah,
I
they
think it
popped
was
up
because
more
we had
since
8
past
staff
few
and
years.
everybody had about 8 schools to do it. Yeah, so I wanna say 63, 64 different.
I think I remember that number from the past, and it was in
Yeah.
the 60s something.
And we worked with the Amish superintendent on that. He was like over the moon, like we were willing to talk to him, bring him in. What would help you? And like, so our original thought was we were going to use non-marked cars for the inspections.
Yeah.
And they said they prefer, because most of the younger ladies that are teaching, they wanted good, bad, and ugly over there. They wanted marked cars so that their staff, the ladies, knew this is an okay person. It's not someone here to harm anybody. So it's going to be that communication because we would have done the opposite,
Yeah.
trying to not be like
Right.
out there in the open. They actually want
Right.
us to be there now.
Okay, good.
Right, any questions on the EH?
If you don't mind, we have a quick presentation on the O&M.
Okay. Great.
And there's some handouts. I'm gonna let this is Christy Pinkley. She's one of our
Hi.
staff members, and she's done a lot. She loves operation maintenance and septic tanks. That's one thing you'll find out about her. She loves septic tanks.
Yeah. All right, I'll give you guys all.
And I just had a question on, why don't we have data for some of this?
For Mr. Lark,
Yeah,
he was out during the week,
so that's
Yeah,
why,
yeah.
okay,
So I'll include it in the next report for a couple of months worth of time.
all right.
Thank you.
And break
No,
it
that's
down.
okay.
Thanks, I was just going, how is it that we
the
don't?
victory was he survived and came back.
Yeah, we're glad, we're glad
Yeah.
you're feeling better.
Still next to us.
You need
Just
another
the
one down
one
there.
there.
There's extra so if anybody needs.
So on the, I think everybody's got, I think there was one. On the screens behind you is kind of a quick presentation we're going over. Operation Maintenance being the biggest program we are going to have by far, it'll outpace everything. I want to make sure you're all very well informed of how Operation Maintenance runs, so you understand if the public asks a question, at least the general gist of how the operations, how that program goes. So leave it up to Christy here.
All right, hi, I'm happy to be here. We finally have this thing up and running, so pretty excited, as Adam said. So here's kind of where we're at. I just want to give you an update, because I know, I think for the past few months you've been knowing that this was upcoming, and we are into it now. We have sent out notices. So we actually sent our first notices October 20th.
And there was 800 of those about approximately.
Yeah, like 750-ish about, yep. And then, we actually had a public meeting that's what that yellow, little insert, we put that in the letters with it so people could register. We had about 22 people, actually came to that public meeting, to give some input on the letters, ask questions. I think actually it went about as I expected, and it went relatively well.
We had one grumpy person, but we had 21 happy people. Well, not happy, but they were grumpy.
Understanding.
Yeah, I think
Understanding.
that.
Receptive.
Yeah.
And then, we're about to send the payment reminder postcard, tomorrow. And that's just for any of the accounts that haven't paid. I'll go over that in a second here. The payment will be due the last day of November. And then, so like I said, we're currently receiving payments and we will begin sampling soon. We're thinking sometime soon after Thanksgiving. So right now, we're at about 25% of people have paid. So I did actually just check in Lake County, where we've been running this program for a long time, and we track these same kind of stats, like how many people pay before the postcards, how many people pay before they get like the certified late notice. In Lake, we're operating for people who are getting the letter for the first time. It's about 40%. It hovers around there, anywhere, a little 35, 50. But for new people, it's about that. So we are lower than that, and I think a big part of that is just that people in the community are not familiar with it yet. So the postcard is actually designed, and that's also one of the things that I gave to all of you guys. That's designed to help get people to call and ask those questions. So it's actually specifically meant to be not vague, but we keep it general so we can just put people's mailing address on it. Someone can just do that super fast. We don't have to print them specifically, and it gets them to give us a call. I got a bill. So that's all good to go. And also our clerks have the software so they can send emails to, with a notice, reprint it out. But anyway, so far we have $29,295 payment, amount of money in payments so far. And then that's out of $117,000 total. That's gonna go up because I'm sure some of them are gonna get the 25% late fee. So anything that remains unpaid by
June 1st, which is when we're going to turn that into the auditor's office. That's going to get assessed to the property taxes in September of 2024, and then any of those, or all of those, will then be paid through those property taxes and dispersed back to us in January of 2025. I guess the line a little weird, but anyway, so far we've made a lot of different attempts at communication. It's going to be hard to get people, you know, to understand what it is until they get the letter. Like, we did host some meetings with the town halls and the townships, and
A whopping attendance of
0.
1 reporter.
Oh, yes, sorry, I should say 0.
Anastasia was lucky one
Yes.
person.
So we're gonna start doing some more regular meetings with the public and with all the different stakeholders so that people in the community are more familiar with it.
My guess is when people start receiving this, then this meeting might go, oh, maybe I
Well,
should
that's,
go.
we went from 0 or 1 to 22 just from the letters we got the first time. So we had, you know, more or less a 20% increase in people attending.
Yeah.
So,
Yeah, and keep, I was going to add to Dan, is, you know, that was originally 2015, a 10-year phase-in. You guys are now looking at, we're looking at 6 years, and you started in April, so this is, you know, a good leap forward already.
Yeah, definitely. So yeah, all we have left for this particular batch in terms of payments is the reminder postcards, which are going out tomorrow, and then the late notices, which will go out early December. Here are all the things that we're still hacking away at. We're going to use something called stamps.com to do our certified letters. That way we can do it electronically instead of the old-fashioned way. It would have been so much clerical time to do it the old-fashioned way. And that's what we use in Lake. We're making some changes to the phone tree because we've noticed a lot of confusion when people are calling in. There's actually some outdated staff members that are still on there, so it's due for update anyhow. And then we've got a sample tracker ready to go. I'm about to send that out to all the different staff that might be involved with the sampling and mailing the results. So we are going to do kind of a bulk process to mail those out at the end of every week for the sample result letters. We're going to set up an online payment portal. That's the thing that we were having a lot of issues getting going for this very first enrollment, just kind of some of the red tape with other agencies to get that out. So we weren't able to do that for this time, but by the time we hit our next batch of these MPDS and spray system sampling inspection letters, that should be in place, I'm hoping. So that's going to be for like March is the next batch. We need to actually set up what our ongoing program is going to be. So the operation permit fees, terms, and like the schedule for everything. So we have that, that 6-year window that we're trying to hit. You probably saw my headache of a spreadsheet from before of, the plan for how everything's going to get in. But we're going to actually nail down what that means and figure out what's our highest priorities and how to logistically manage that in 6 years. And then finally, we have a lot of standard operating guidelines from Lake, which is one of the benefits of coming together like we have. But we're going to customize those for geography because there are a few differences. So like I mentioned, we're just going to also get some stakeholder input. We've already done that with the Elgar, and we're going to be doing that for our sewage contractors. They're actually going to get a little insert on their registration renewal mailing that's going out this week about that upcoming meeting, and then we'll also send out an email with pretty much the same materials that I provided to you guys, just so that they're aware, because they're going to start getting, they have already started to get some of the calls like, this person is saying I need service, and you know what I mean?
Right.
They're just like,
Yeah.
they don't, aren't familiar with it here in Geauga necessarily. Like I said, we're going to start doing public meetings on a regular schedule. We want to kill this thing with communication, as I know Adam said. Make sure that we're out in the community and people are aware of the program and what to expect. And then part of that stakeholder input is going to be going into figuring out what are those permit terms and conditions, what is our priority, and how are we going to enforce for the program. So now I'm kind of switching gears a little bit, but before I do that, do you guys have any questions on the O&M stuff? I know I gave you guys a lot of materials to kind of digest there. Let me go through those real quick before I go into this.
And we
but-
will have regular communication about O&M with everybody, just so it's, I don't want to say it seems like a pain in your butt, but it's gonna be kind of education for a long time, because this will be by far the biggest program the health department has, probably indefinitely. So I'd rather you guys know it inside out, and be bored of it, and not know it and be like, I don't know what they're talking about. It's, you know, it's not something we do that often.
So there are two versions of the letters that were sent out. There's one for NPDS systems and spray systems. So the NPDS systems are required to be sampled through the EPA, and that's something that they signed and agreed when they put the system in. But you know, we're trying to work with people because we understand that hasn't been happening. That's why this change was made. And then we are also going to be sampling spray irrigation systems. It's a little bit different price just due to the difference in lab analysis costs, but it's the same thing. That one is just a local requirement to sample because those systems can pose a higher risk, honestly, to the owners of those systems themselves. We just want to make sure that they're, you know, not getting bacteria in their yards. So as I mentioned, this was the registration for the homeowners to come to that meeting. We're trying to move into the 21st century here with like QR codes and stuff. And then this is that postcard that we could just slap their mailing address on. And then we did send all the letters in this envelope with a bright fluorescent pink, and we're gonna keep doing that
Yeah, it's really
because who
smart.
expects to get a bill from the health department? They're not used to that yet.
Yep.
The final thing I included, I don't know that you'll be too interested, these are just like the reports that we're gonna fill out. So we're doing a sample and an inspection when we're out there. So we're gonna just check that the system is operating as it should, and then we will collect the dissolved oxygen in the field. These other three measures are gonna be analyzed in the lab, and then we have some other things here to track, like, you know, so we know for future reference, hey, this person has a dog, we need to call in advance, or they have a fence, or, you know, some other kind of issue like that. And then the spray one is similar, it's just different parameters. Do you guys have any questions on?
I think this is great.
Okay, fantastic.
Yeah, this is all wonderful and very informative.
I think it's gonna be very informative and very helpful because even I don't have a clue sometimes about any of this. So I think it's gonna be very, very helpful to understand what the systems do, how they work, and, oh geez, this is a spray system, I mean, just to look. So, very helpful.
The only question I have is, we require that people have a service contractor and also this. So is there either a duplication in efforts of the inspection itself? Is that a purposeful redundancy that we're doing?
It is purposeful, and I will say it this way. So part of the language in the code that allows us to charge a late fee, which we need to do to be able to cover the cost of sending a certified letter, it says inspection in the code.
Okay.
So we are also doing a sample and an inspection. And it is, we're not doing a service on the system, and that's really what that service contract is for.
Okay, so it's a different thing. Okay, that's
But
just like,
it's-
because
They're
that
required to
question
have a
come
service
up.
contract
Yeah.
Versus,
And there was some
Got it.
vibrant discussion about this probably 2 or 3 years ago, and the discussion was more of, the board at one time asked, why don't the contractors or service providers take the sample? We're ultimately responsible for
Yeah,
the sample.
right.
So it was if they take it, or if they don't take it, we're responsible. If they do take it, we're
Yeah,
responsible. So
and
why would we not
having
do
the same
ourselves?
lab and everything, I
And
guess,
the cost also would have been likely significantly higher because
Yeah.
we're getting the bulk discount with all the things. We're actually opening our own labs, we do it ourselves.
nice.
Versus taking it to
not only
everybody else.
cost, but capacity, just not there with the private
Yeah.
groups.
Right, I think a big piece of education would be to make sure that people know that, yes, we are doing the inspection and the testing, but they also still not only like need a service provider, but that service provider still has to provide service on the
Yes.
system, even if that inspection is containing the same inspection components that you guys are looking at.
Yes.
I think that could be missed if we don't really hit that point home.
Now, as far as the cost of the program, we also have to like randomly sample so many to check to make sure
Yeah,
the service
yeah, and if
providers
you fail
are
a
kind of an
sample
auditing
and,
thing,
uh,
Yeah, we end up doing audits on all the service providers
Right.
too, so we can
Okay.
make sure
Yeah,
that
that's what I meant.
as we're asking the the residents to support the program, we wanna make sure they're getting what they're paying for.
Right, exactly.
So we audit the service providers to make sure that what they turn into us, you know, and then we go out with their service reports and make sure they've actually done what they've said.
Okay.
Yeah,
And
Cool.
reporting accurately.
costs and stuff.
Dan, did we ever get a response back if there's not 2 service providers from the state?
No, they're not.
We did ask if there's not, so every system
For
supposed to have
every
2 service
system,
providers. If there's not, what do we do? And I think we posed that question to the state, and we haven't heard back yet.
Yeah,
as
they
to-
won't answer it.
Is
That's
that
because the
what's
question is,
happening?
what do we do?
Yeah, there is one system, I believe, that there's no service providers in this county, or is there one?
I'm not sure, to be honest.
I thought there was one that had 0 or 1.
Yeah, we're not very local, I can't recall.
Yeah,
either.
maybe it was local. There was, this came for a reason though, and it was a while, it
It wasn't
probably
just a
6 months ago.
hypothetical question.
Yeah, it was more of like,
yeah.
this is gonna happen, what do
Yeah.
we do?
Yeah.
And what do we tell the homeowner? Like, we can't just say, sorry, tough luck, I mean.
Right, and if you are, choosing a system to install, you really should have the education to know what service providers there are,
Right.
if any,
Yeah.
which, there has to be, so, okay, cool. I just wanted to clarify that point, because I think that's something we need to educate on, because there might be some confusion that it's not necessarily a duplicate effort, but sort of, but in a purposeful way.
Yeah, and definitely that's one of the top questions that we get. It's the same, we do the same thing in Lake. And it's kind of funny, the thing about the postcards, it doesn't, again, it's not enough space to give very much information.
Right.
But I'm kind of happy because it gets people to call, and a lot of these things, it's so
Mhm.
much easier. You can give someone a page, a 6-page thing, they won't read it.
No, I
So,
think that's good.
when you get to talk to people on the phone, that helps a lot. So I make sure to cover with anyone who's dealing with people on the phone. But yes, thank you so much for that. We will keep hitting on that.
No, this is great, thank you.
Most everybody decides to call anyways, so you just kind of
That's
sort
good,
of
though,
that,
right?
yeah.
We have found by sending out the postcards, we've increased our return rates on some of these things without having to charge late fees by, 10 or 15% typically.
Okay.
Yeah, and Lake
So,
County.
That's good.
We've tracked that to see what that difference that made, and we've seen, a pretty good increase in
Small
return.
cost for us, big return on investment for the public.
Yeah.
Right.
And
Better
that is
rapport
kind
with
of
the public, too.
accreditation, and we complain about accreditation, but we may or may not have gotten to systems like that if it wasn't for accreditation. We'll really find out that tracking it a little bit more
Mm-hmm.
purposely, documenting that, does that return on investment, so that's some ways that we.
I think,
implement.
I know frustration at the meeting was the late fee's 25%. We don't decide that, that's a state thing.
Okay.
So
That's good to know.
it's not like we're saying, hey, we wanna charge 25% for late fee. That is, you
Also
will charge 25%.
Right.
And so the more we can do to make sure the public doesn't incur that, the
Yeah.
better off for them, which is better off for us, 'cause they're not as mad at us.
Are we
Yeah.
allowed to waive?
We cannot, no.
Oh,
Yeah.
interesting.
Because that goes to food fees as well. We can't waive
Yeah,
late fees,
state's
food
board.
fees. It's just it's a flat 25%,
I
or
guess-
whatever your fee is.
When does a late fee go into effect? How long after? So I guess what is the timeline?
I don't know
I
the
think
timeline on
most
that
years
one.
past the
You-
deadlines,
Yeah.
but they just, a drop dead date.
Okay.
What's the,
So
yeah.
like this
So-
first round is November 30th.
Okay.
It is.
So-
We usually apply the late fee, honestly, like maybe a week after that to
Okay.
give people a little extra window, especially like the
Checks
mail
the
can
mail
take a
thing.
long time.
Right. Only because
So-
I bet we'll get asked, is there a,
Yeah.
leave
On
it
November
in?
12th, somebody's gonna be like, well, you know.
You gotta cut it off at some
Is
point.
it through?
Yeah.
So I have a couple questions.
Yeah,
So the NPDES system and the spray system are the ones that we're starting with?
correct.
So how long will it take to get that through the whole county?
1 year.
1 year. And so we do that,
Mhm.
and we have to keep that ongoing,
That's correct.
right? But what is the next phase that is after this?
That's part of what we're gonna be figuring out in the next few months. I think we all have some ideas and we know
Actually,
some of the
Monday,
challenges.
we're gonna sit down and start going through that, what our next
gonna phase.
phase we need to hit. The first one we do is because of
The complexity. of it.
the putting out, if these aren't working properly, they're putting raw sewage out into our
Right.
environment. So that's why these are the first ones, and the next ones are gonna be, actually Monday, we're scheduled to meet to actually begin planning that next, to make sure we're.
I don't want to say slow roll, like, sound bad. It's more of a slow roll in terms of, we don't want to happen what happened with for sale property, happen with this, because
Yeah.
the next portion is the vast majority. So this is like 2,000 systems.
Dial it
The
in.
next portion is gonna be possibly up to 38,000.
Yeah.
So the next one's incredibly important, that if Christie or Dan or I or somebody else makes a mistake on how many we can handle,
Right.
you're a year behind, you're 2 years behind, you're 5 years behind. And that's incredibly important not to happen.
And that ties to my next question, which is, we've been talking about how many personnel we need
Mhm.
to implement this program. In this lower phase of the program, are we able to do this with the personnel that we have, or do we immediately need more
Right now, we believe we can. We are bringing on one additional clerk, not additional, sorry. It's under the contract. Previously, we had someone else doing it. That person retired, so we're bringing a person on. That'll bring our clerks up to what the contract already had. I think I mentioned last meeting, we want to wait until after the levy, which we'll talk about that in my section, that we need to probably bring one sanitarian and one clerk on to get the next system program side up and running. And with
So that's the program after this year?
yes, that's the secondary, phase 2, if you want to call it that.
Yeah,
That's
stay
the
ahead of the
phase
critical
2.
mass.
Right.
And that's to go a little faster, I mean, not in a bad way, just to get that program up and running. And it's gonna take longer than we expect probably in general. So the faster we get going on it, the faster we can make decisions and get things to you to have your review. Some of the stuff is gonna come back to you for different things, and that's a month right there. And then you lose a month implementing, and then you lose a month getting things sent out.
Yeah. Plus
So-
the revenue flow is critical to time that, make sure we don't get too thin, too fast, without bringing it in.
Oh, sorry, go ahead.
No, go ahead.
I was just gonna say, one other thing is, we try to actually spread everything out. That's why it's like over the course of a year, like if we wanted to, would have been a bit of a lot of cramming at the last minute for me, I suppose, but we could have put all of those MPDS at once if we really wanted to, and we could do that for some other things in the county. But what that gets us into is then we have these fluctuations in the workload, and so then you're not being efficient with.
Yeah, feast and famine kind of,
Right.
Exactly, so
any
we,
contractor thoughts.
exactly, and then the other nice thing is, like, especially with these sample ones, we have it in 3 batches, so that, like I said, the next one will be March, and then the next one will be July after that. And so at least they're not going more than 4 months between getting a letter and getting a sample. I mean, I know it's still a long time, but at least we aren't showing up there and they're like, what the heck are you doing here at
3
all?
years later.
Right, I was gonna say.
Yeah, exactly,
Or
exactly.
5 years later.
Yeah, and then, sorry, what?
So on the other end,
Mhm.
or completely separate from inspections, there has to be a group of people, you know, whether it's a commercial, non-commercial residential environment, that are totally ignoring inspections or purposely, without regard, polluting.
Mhm.
Is there any way to be able to detect that, or?
I can take it or you can.
Go for it.
So-
I'll jump on if there's something else.
Okay, yeah, so there's a couple ways we can get at it. It's one of the harder things
Right.
to measure in this community-wide thing, because we've got 30 to 40,000 systems just in this county. And we can only really process the information that we have. So if service providers aren't used to turning in the reports, even though they're supposed to since 2015, if they're not turning in the reports, I don't even have that to go off of. We don't know what we're not getting, if you can follow the double negative
Right.
there. So in Lake County, and I guess I haven't spoken to you guys about it here, but I suppose I'm kind of guessing at some point we might do something like the stream sampling program that we have there that can help to monitor the water quality in and around septic areas of the county, which is most of this county.
Yeah, so one of the things we try to do is, you know, this is a big investment from the community into us. And so one thing we like to do is try to be able to try to prove some return on investment.
Yeah.
So one of the things we've started before is where we've gone out and actually, we do almost 30 different sampling spots throughout the county to try to measure water quality, and then we do it on a quarterly basis to see what kind of improvements. Hopefully we can show some type of improvement to the water
Yeah.
quality and stuff. So
That's really cool.
some things to try to show return on investment, you know, and we do it on a GIS map, so then that way it's easily publishable on the websites and stuff like that. So we try to do some of that stuff besides education is, you know, try to give something to the residents so they can say, okay, they're not just coming and taking a sample and then we don't see anything. We're trying to measure water improvement throughout the cloud.
Right, so people understand the,
What we're doing, why we're
indirect
doing.
and direct benefit of
Right.
this process. I guess to Dr. Hendrickson's point is, if people are, billed, they then don't pay the late fee and the bill. Does this follow the same pathway as, when people go through like the nuisance complaint? Like, are they gonna end up at the prosecutor's office?
So at least for this one, what we've been successful with, at least for MPDS portion, is, we go through the whole steps, they get all this notification, and we go out and knock on their door if they don't pay, and we say, hey, we're here to sample, and we take the sample. And then we go through the whole process, and we've actually been very successful at doing that. and had a very high success rate. We really haven't had anybody say, get off my property.
Okay,
We're
good.
not complying at all.
Yeah,
So,
that's in Lake County though, we'll see how it goes.
Yeah.
Yeah.
We've got more guns in
Land
this county,
freedom.
yeah.
I mean, until you hear the you're
Yeah.
okay.
Right,
At that
right.
point, you're
Wear your
nervous.
running shoes.
Yeah, seriously.
Is there any way is there like a dynamic GIS mapping or some type of mapping where you pick up, there's some signal that, you know, alert you to some high-risk area?
So, yeah,
If you
so
noted
like
it.
the one program we've put into place, what we did is we actually went through like the watersheds and kind of where there was an area where it seemed like there was like a conjoining of like a lot of, like a little
Okay.
region where we have an easily accessible sample site. So we're not having to like climb cliffs to get to something. You know, then we would do like off a bridge or something like that where we could go to a creek or something and sample from those locations.
But is
So-
there anything on imaging that would indicate, I don't know if this is even being done, like periodic imaging and then,
Here's,
something shows up that
I'm
wasn't
not sure
there
if anything
before?
that sophisticated where, I mean, besides a
most of
Great
those-
green grass.
Yeah.
yeah, sometimes you can see from, you know, the GIS maps, like you can
Right.
literally see the lines
Trench
because
lines to green.
the grass grows where you fertilize it. But
It's
but-
hard to look at, you think it's
right, the stream sampling is like the mile high view, but part of our performance management system that we're gonna get to implementing here is we measure things at multiple different layers. So the further out you get, like when you're doing stream sampling, a lot of things can affect that. That's not all on us, but what we
Right.
can try and control is the service.
Right.
We can't tell someone, get different soil or topography or a lot of things like that. So we're gonna track the surface, and that's what we have in Lake that can really zoom in on those people, the problem people who are not doing anything about their systems. Maybe at some point we'll get to the point where we can see that certain communities are, you know, more or, you know, better or worse about getting their system serviced or those kinds of things. But right now, at least it's on a system basis, we're tracking it through those service reports and pumping reports. And then in the case of these MPDS and spray sample or spray systems through the samples directly. Did that answer your question? I know it's like,
it answered 5
It's a hard-
questions. It wasn't
yeah,
yours.
yeah, I'm sorry.
It's a relatively antiquated system to work with to begin with, but.
I think
It's been built out a lot though.
Yeah.
I have to defend it a little bit.
I think it emphasizes the importance of, you know, on the flip side of when people want a system, all of the, you know, stop checks that are in place with the soils, the design, the permits, the approval and all of that, and the importance of it. So, I mean, it's twofold, right? It's the monitoring and the implementing.
Exactly, yeah. So some of that is gonna come into effect once we really get to the enforcement phase, because the way these things work, you give someone, okay, here's a period of time and here's what we want you to do within that period of time. Well, you can't say like, you haven't gotten it done yet. It's like, well, I have 6 months left or I have 4 years left depending on what your permit term is. So that's gonna start to come on the later end, and then we can really start to track it. I can tell you in Lake County, I think we hover around about a 70% compliance rate there of people getting the service that we're requiring them to get.
So based
Just
on,
in the back of your mind, you always think, you know, with the illicit drug use, just using that as an example, in the back of your mind, you always think there's, you know, the people that are doing that aren't gonna call up and say, oh, can I come, have you guys come by and inspect my lab?
Right.
And, you know, make sure it's good.
But if you're questioning that, we will.
are they on your
With the
food?
cops.
So is there some way to identify those people that would never, ever call you up, that are probably producing some pretty toxic
Yes,
crap?
yes,
Yeah,
exactly.
I already got those calls.
So, what we did in Lake County and what we will soon do here is we will basically take a list of all the parcels that are on the auditor's site and all the like addresses that are,
So the ones
sewer,
that never
if-
show up.
if you have a house,
Right.
you're not connected to sewer, it's going somewhere, you know what I mean? So then they
that's
get
true.
put into our system so that we can make sure to catch everybody, because, yeah, we don't wanna miss people and we
Because
wanna try and hold
Ohio and
fair,
Geauga surprisingly has some of the highest drug use in the country. I mean,
right?
comparable to New York and West Coast.
Right, I wish, oh, sorry, go ahead.
No,
I was just gonna say, I wish we could do something like, you know, during COVID-19, or I know they've also done it with the drug monitoring. They actually do monitor the sewage of all things. They can actually sometimes track it back that way, but I don't know of a good way. The stream sampling is kind of our version of that.
No.
So that's not GEOG.
One,
Yeah.
one last kind of question that you briefly touched upon, like initial permit phase.
Yeah.
I know in the past when we discussed this, when people get their operating permit initially, there's a term on that.
Yes.
Have we educated the public that yes, you get that, but then you also have to do the operation and maintenance? And how are we rolling people in? Let's say I got my initial permit right now to operate. And then will I get this mailer that also says I'm due to be enrolled in this
So-
by the 30th? Like,
So one of our big tasks is that this health department has issued operational permits for 20-year terms, 10-year
Yeah,
terms,
And 5-year terms.
and 5-year terms. So we have to, that's one of our things we need to discuss is how we need to, because if we issued them, we're gonna honor them, but we need to come up with a method
to
to
enroll people in.
to enroll them into that,
Yeah.
but then also track those so we're not charging people extra for an operational permit
Right.
when they've already paid for a 20-year permit, for instance,
Yeah.
which, so it's kind of a.
And is that
It's tough.
kosher now?
Complex, yeah.
No.
Yeah, it's very tough.
No, so it's kind of one of those
I'm not-
systems we need to come
It
up
wasn't
with.
kosher then, I don't think either.
Yeah, no.
Yeah,
It
that's,
wasn't,
it's,
but yeah.
that's a challenge, and I don't know that
Very
there's a
hard
good
to
way.
permit.
That's
There are
why I
hard
wonder.
laws
So
that we
so
need
that's
to
part of our
have.
discussion on Monday
Yeah.
is.
Or my master
So
plan.
how long is the permit?
So what the state says is the longest you should issue one is for 10 years.
Yeah.
But what, in our discussions in doing this is, 10 years is really too long to go between managing your septic tank, pumping or not.
Right.
And honestly, because of some of the software limitations, we actually did a 5-year permit before because then, with the regular old septic tank system, in that 5-year permit term, we want to see one action on your part, whether it's pumping your tank or a report saying you don't need to pump it.
Either there.
And so that's one of the reasons we set a 5-year term, because 10 years is too long for like most
Yeah.
places to not pump your tank up.
Especially when you're not tracking
Yeah.
sales
And then,
of property and things.
Yeah.
So it's yeah.
It's usually recommended every 3 to 5 years anyway, and it makes sense to tie one permit term to one action, right? Because if you say you're supposed to do 2 things within time period, what if they do 1? How are you gonna follow up on
Yeah.
that? And then if you say you do something every 3 years, but you give them a permit every 3 years, how do you know which year is the 3rd year? You know what I mean? So
Right. I know what
it's
you mean.
1 per 1 is a good way that we found to do that. But you had another question. Oh, but yeah, we do have a way of phasing them in. I don't know, I don't want to make you stay here all night, but
No,
yes, I
that's
do
okay.
want
As long
to
as
assure
it's
you
been
that we've given
addressed,
that
that's
some
what
thought.
I trust you guys, so.
So,
Yeah.
yeah, we'll be able to honor, we'll have to discuss, but yeah, we'll be able to honor those permits. I've extracted, I'll just say this, I've extracted that data already from the database before I made changes. And some of that is gonna have to essentially be tracked through an Excel, and then phased in. So this right now is only charging, this is not a permit that were issued. All of these systems were already issued permits by design, because all of these systems are relatively recent probably. This is just the sampling, so over time, we will phase those in, and at some point, once we establish the new fees for the permit, there will be a version of this that includes the sampling, inspection, and permit fee combined
Got
into
it.
one,
Okay,
as
cool.
new
Yeah,
people
and we'll,
can
and
phase
so
in.
probably in the next 2 to 3 months, probably
Hopefully.
we'll be coming before you with a whole big
Plan.
schedule with all different
Yeah.
terms and all kinds of stuff like that.
Awesome.
And setting new fees for a lot of things also for that, in that program.
Yep.
Cool. Well, thank you for addressing all of those.
Yeah, one last thing. This is
Yes,
House
I'm
Bill
sorry, I
110.
just wanna show you guys, just this, the House Bill 110 inspections. I imagine you guys have heard some about those systems, so I don't know how familiar you are, but we've got about 300 on-site systems. Those systems, it's pretty obvious if something is going wrong, because the primary failure for those would be sewage coming to the surface of the ground. So thankfully, there aren't very many issues that we've encountered with those. They get inspected about every 3 years for EPA, or under EPA contract, I should say. And then we have about 100 discharging systems that we inspect on an annual basis. About a third of those had some kind of recommendation or violation that was made by our inspector. About half of that third required further follow-up. It could be things as simple as weeds growing within the filter bed. They need to rake or alternate the sand surface belt. I can't talk. It's not subsurface, sorry. It's just a sand bed. And then we're adding chlorine tablets for disinfection. And then about 5% of the total 100 discharging systems, we're actually referred to the EPA for a nuisance. We do some additional follow-up, but we also refer that to the EPA if the aerator or blower is not working. That's very important for the treatment prior to discharge, just like these NPDES and spray systems. And then if the sand filter is overflowing or leaking onto the surface of the ground, that's also something that we would refer.
And if you remember, the House Bill in 10 is the one that we're not doing for almost 10 years. So these are the systems.
We remember, Adam.
Yeah. Pepperidge Farm remembers.
We remember.
Sorry.
And then, no, you're good. And then this is the operation and maintenance page on the website.
Thank you.
We are working on a quick snafu that we're actually help fixing, but it looks very good. It's easy to read, has some easy links that the public can click on. The one thing we're working on is that right there where the thing pops down too far. It's a WordPress issue, so we've asked IT to help us to figure out why it is not aligning properly. Then you go down here, you have the number to call. These are just not aligned properly. And then you have some information down here with the breakdowns and the fees, the permit requirements, education materials, and things of that nature.
Oh.
So pretty easy to read. I mean, pretty cut up enough where you can kind of get where you need to get to, and that's on the new website.
I wonder if
great.
we should do a presentation about O&M at the HDAC meeting in March.
Yeah, it was on my list of probably a thing that would be our hot topic if we had anything, because that is, like, as I told even like the Township Association, this is the health department at this point, is this operation maintenance program.
Right.
Yeah.
And I'm sure the trustees and stuff.
I can't, yes.
You're on
Yeah.
camera.
Hey,
Looking good, man.
Yeah.
Yeah.
Gotta have fun.
I don't want to break your spirit, Adam. But I was just gonna say, I'm sure that the trustees and so forth will be getting questions from their
Yes.
residents, so it would be good to have
That's
an
one
opportunity to
thing
educate them.
And one thing that we're gonna still try to do is when we get to each township, we've done the 2 so far, our goal is still to get to every township
Okay.
meeting, before their township gets
That
implemented.
makes
So
sense. Okay.
we'll still be making that kind of tour over the next year.
Okay.
We started
Yeah,
with Chardon and Chester,
Mhm.
and Chardon had, well, they weren't there for us, but there were people there, and then Chester, they forgot to open the door, so we talked to the station in the parking lot.
The town halls are just such small spaces, so we might see if we can do it in a school or something, because that's why we couldn't advertise as much as possible.
And one of the other things too is we're probably gonna end up having monthly meetings here, just kind of an open door policy where if anybody wants to come on, like every 3rd Monday or whatever, we'll be
Oh,
here
yeah,
and
that's a good idea.
and then they can discuss, yell, whatever they want to do, and we can go over the program with us.
Yeah.
Yeah,
Kind of like office hours.
yeah,
Yes.
pretty much,
Yeah.
but something in the evening so they can
I think that's a good idea.
access, yeah.
Okay. Anything else on that?
Thank you.
You guys so
Yeah,
much.
that's great.
Thanks, Chrissy.
Appreciate you.
Thank you, Christy.
No problem. Thanks.
Okay, Adam, administrator report. You want to talk about why there are no cookies at this meeting?
Yes. It is due to a packed schedule that I did not get cookies or water, even for the one who's dying in the background and eating water. So that's on me. That's on me. I'll take that. Parkman wells, I thought we were done. We did have 2 additional wells. One was getting tested at the time I wrote the report. The other one was tested. He or she came in a little above the cutoff, so we are going to drill them a well. The other one should be fine. And
Okay, so
ironically,
are we getting funding for the one?
yes. I talked to Ohio EPA. They extended it for just that specifically, and it's a hard cutoff at this point. There are no additional dollars
Okay.
unless a new contract is initiated,
Okay.
which there is no discussions about. There is no recommendation for. That is the cutoff.
But that's great that last one's gonna
Yes,
get
they
funded.
were.
That's amazing.
We talked it out, and I said, obviously I'm going to promote the resident, and they're going to promote it with IPA, and they agreed, no, we'll make it right.
Okay.
The ironic part was the well at the ODOT facility tested like a 5. So it's probably the cleanest well in Geauga County. I don't know how, don't ask me, but it came back ridiculously low in terms of any contamination. So,
Did they already replace it?
no,
How old is this well?
it was the
Is
one
it
from
double
the site,
cased?
and I was like, we tested the right one, right? Not like, that was the well. So, casing
makes
depth
you
could have made a
wonder,
difference.
I don't know.
Yeah.
So there was a
So-
total of about 200 and some?
No, we drilled 250 was the cutoff for the parts per million, but it was 25, 22, 25
Yeah, so,
from there.
Okay.
we have a staff member actually working on an updated map, so that way we can show you like the whole
Awesome.
region
Okay.
for next meeting, so we should have a
Good.
nice map
Cool.
of that.
And we're doing GIS, so it actually it's gonna look really nice. You see overlays and other things. The levy passed, which is probably the most important thing for the entire meeting, at least from my side, is levy passed. Almost 2/3 of the voters supported us, which we're very appreciative of. Operation and maintenance, as we had the discussion tonight.
I just wanted to mention that we're very appreciative to
Yeah.
Mr. Perrone
Yeah.
for
Yeah,
all of
Thank
his
you.
absolutely.
I don't think we could have done it without you.
He worked long hours, so how skinny he got.
I'm just glad it passed.
Yeah.
I'm just glad it passed.
So lots of yard signs out when I was driving around.
Yes.
Saw them at the polls. I was very impressed. I was like, man, he was working hard.
You had some guy that came offer you a yard sign, you say yes, take it, put it in your
There were
yard.
a lot of mailers that went out too.
Yeah.
So
Yes.
that was
Yes.
Very
very helpful
fortunate.
for the Realtors Association.
We are doing Serve Safe, and I put November 9th, 8th, and 9th. We used to do it back to back. We actually split this out over a week. So today it was not November 9th. It was actually today was the second part of it. We're hosting this classes here in Geauga again, which is just down the hallway at the big conference room. So the people that need it here are, I'm sure, happy they don't have to drive to other counties. They were going to Trumbull or to Portage or elsewhere. So that's good. And then we can talk about the budget, I guess, when we get down to the new business item. Other than that, that is it for me, I believe.
We want to talk about the financials now, or
Yeah, we can do that one now.
anyone have questions on the financials? I do, I'm sure. Oh, so
Sure you
this
find English.
public entities pool.
Yes, that was
Oh,
the
Thirty,
30
like the
something.
one that's only 36. I know that's insurance.
That's our insurance
right? And
company.
that's an annual payment.
That is our annual payment,
Okay.
yes.
That's
Okay.
and is that consistent, or is that because everyone keeps suing us?
No, that's actually consistent. That's
That's what I
actually,
was wondering,
Yeah,
because
we
the
get
dollar
3 bucks in the
figure.
account.
yeah, it's pretty
I was like-
consistent. I don't, so as an entity pool, I don't know how, well, some of it's because we have qualified immunity on things, but we pay very little in terms of, that's our cars, that's any space,
Oh.
that's all
Okay,
assets,
that's not-
that's
okay.
Yeah.
bonds, that's everything. So everything we do is covered by that single payment, which is, we actually, in Lake years ago, one of the board members said, hey, go get quotes. Because we have qualified immunity, they can't even bid on it, almost any private entity. You have to go to a qualified public insurance company,
Okay.
which there's only like, there's Corsa for the county,
Yeah.
there's Public Entities Pool, and there's one or two other ones.
Okay.
But PEP has, Public Entities Pool, PEP has, I actually have the book in my office, it's almost every township, village, health department, they've almost
And
everybody.
it's as cheap as you're gonna get.
Yeah.
I just didn't know if it was like, you know, you get a car accident, your car insurance goes up.
No.
and-
I mean, I'm sure they wish it was structured that way, because then they'd be billing us 5 or 6
Okay.
No,
times
I
that.
was gonna say.
And what is the 21,000?
For,
Is that remittance to the state? Is that what it is?
was that the remit? I just passed mine down to Carol. If it's
Yeah,
the remit,
state of
if it's-
Ohio.
State of
Yeah, if
Ohio.
it's remit, those are vital statistics or food fees, that's their portion they get from us for any of our fees.
Okay.
I do believe we have the record, Lake County, and for our building, and Summit County are the 2 largest claims ever made through PEP, or at least a few years ago.
For your fire?
In the millions.
Unfortunately, so they didn't drop us, they didn't raise the rates, so pretty
All
well.
right, let's roll, right? I think we do, yes. All right, so any questions about the administrative report or finances? Did you want to do the budget
Yeah, if you would like me to now, I can
now,
do
or
it
do you
now.
want to do that? We're under, it's under new business.
It's under new business, that's why I said, I'm fine either way.
Let's
We
wait
can
till new business.
Okay.
Okay, health commissioners report.
All right, so the 2 unlucky gentlemen over here were on the work group to help learn a little bit about accreditation. So the met with Dr. Hendricks and Dr. Rue, I think next Wednesday. Provided you with a packet, kind of the past fees, the future fees. We're in year 2 of the 5-year cycle here for Geauga.
You gave us the most voluminous documents humanly possible.
They had that, we go through, we cringe to have nervous
Better
shakes
be
from our
thorough.
accreditation discussion, so. That's the best I could get at the spot, so you have the binder and you have links to a site to get that, I can provide that to anybody in the public that wants that. Primarily the application, we had an extension, that's why I passed out to the board there, it's a few pages. Is the information I have to present by the end of December. Wanted to wait till we saw the status of the levy, because anything that threatens your ability to maintain accreditation needs to be reported, so there's no sense doing that. So talked to April Harris, one of the head of the FAB over there, and they're gonna be pretty flexible given our situation, unprecedented amount of cooperation, unprecedented kind of just circumstances that the board's under. So I think we're good for the 5-year, the remainder of the 3 years will be flexible. We do have to have a discussion about a full-time accreditation coordinator, which I think we can split part-time over these 2 agencies. I think we could get them to agree to that. We wanted to provide that application just quickly. This application, again, we provide updates on some core initiatives which were cited during the site visit 2 years ago. There's 5 standards that were reported that were slightly demonstrated, so basically the lowest rung of like, we counted this, but you're really not close. So after reporting that, emerging health issues or innovations, we're gonna talk about the shared contract. I think that's of interest to them nationally, because again, the scope of collaboration. And the rest of it, we're gonna just be as honest as we can with what's in place and what's not in place. So the 5 standards that we really have to talk a little bit about are health promotion strategies to mitigate preventable health conditions. So I'll send this report. This is the one with 72 pages, so it's probably not printed. That's section standard 3.1.2A. It's the Cribs for Kids program was one of the things we cited, the crib program. That's since been defunded, so that's no longer there to count that. Laws reviewed in order to determine the best need for revisions. That was very weak. In fact, some of the paperwork cited the wrong agency kind of typo things. There was not enough documentation in the food service charts, which I think we're working on with that. That was 6.11. Access process to assess the availability of healthcare services needs to be addressed. So there's a laundry list of them. Some of those are covered by the contract as we do countywide planning, we do regional planning. Some of those are very tangible. You have to have a person with a evidence-based program and a population service, which we don't have. So I think we can build that over time. But I'll walk our work group through that kind of stuff and then get the report probably to you next month to take a look at and approve that, and we'll get that shipped off. The only thing during discussions, we talked about a little bit of, I know there's always been a contention on the savings for public health, so I just wanted to go remember staff and management, we have a lot of savings. Food fees, we have some savings because Dan, not only did we reduce that staffing, but it brings additional revenue in because he's part of both fee structures. So collecting more of that administrative time back helps the overall contract. We can kind of discount that time. Process, we talked about the stamps. Some of that is just, a person, some of that's just cost, volume discounts, efficiency discounts, things like the payment portal. Those are things we're implementing and they're not as tangible to put a dollar amount, but we are doing our best to track that. I think Adam, Mr. Licky there will be part of his master's completion will be kind of documenting that process, trying to work that into his capstone project, forcing us to provide that information and actually be able to give to the accreditation board to say, here's an innovative model that's saving a lot of money, and how can we do that? So that should be slowly rolling together. For 1st of January, we'll have kind of 1 year numbers coming up close from April to April, and do some comparisons and get that out. I'm also making revisions to the newsletter. President Breaky looked at that, made some comments. We'll get it back out. So that before the end of the year, we'll have that report out, newsletter out with your approval. Otherwise, if you have any questions, shoot. Okay. Thank you.
Any questions?
Not right now.
Little light reading.
Yeah, when you get through your light reading.
3 to 500 pages.
Yeah, you let
Put
it
it by
go.
your bedside table. Old business, Geauga Public Health rent discussion.
I just want to hand that off to you so you can
Yeah,
just go run with it.
I think that.
I think everybody's
this-
gonna love this conversation. You're gonna love this conversation, honestly.
Well, why don't you provide the backstory, Adam, and then I can provide color commentary.
Dan's why you do that.
So a wee bit back, we were approached by the county, and the number originally was 58,000. It came down to like 48 with some adjustments on the space, and then we were gonna get a little bit lower than that, about 42-ish, if we give space to IT as being the old lunchroom that we really don't use that often. It's more of a pass through than restrooms, and one closet storage area there and turn an office. One of the things that I provided early on was a copy of the ORC that says a county may provide free space to a health department, usually says general health department. And that discussion was kind of like, well, it says may, not shall, so we're not going to do it. That was kind of the adjustment on that. Discussions further went, and there was discussions like, where could we reduce space to, how much? That's when I came to all of you and said, do we want to have a desk for everybody? Can they have a hot seat? And it was one desk for everybody. We'll make sure we have room for operation maintenance. Is that it's going to have to grow to make sure we stay on top of it. And then during that discussions, your president here, there was a discovery of the Ohio Attorney General's opinion on the May, and I'll hand off to you. I'm sure you'd love to talk about it.
Well, yeah, so we came across these Ohio Attorney General opinions. In summary, the first one says that the Board of County Commissioners has to furnish suitable quarters, and they have to do it without a rent payment. The second one says that the Board of County Commissioners has to provide and pay for all the utilities necessary for the health district. And then the final Ohio Attorney General opinion says that the commissioners also have a duty to provide janitorial services at no cost. So, because I didn't want to violate sunshine law, I obviously couldn't send this over to the full board, but I did send this over to the commissioner's office, and I said I would be presenting it to you tonight at this meeting, and that I would recommend that we cease any further discussions regarding rent in light of these opinions. I sent that a little over 2 weeks ago. Took them about almost 2 weeks to respond to me. And they informed me that they have had these Ohio Attorney General opinions this whole time.
Seriously?
And yes, seriously.
No wiggle room in there.
What was the time interval on these three opinions from the?
They're not from they're from a long time ago.
Yeah, they're recent.
But that's my point.
Yeah, they're not recent. So for example, the one that's most appropriate as far as that the Board of County Commissioners has a mandatory duty to furnish suitable quarters to the board. That one's from 1985, but there is there's no intervening opinion since then. There's no intervening case law since then that certainly that we could locate. So that's still controlling.
And so what did the commissioner say?
So yeah, the commissioner's office started by saying that they had already had these opinions, and they were of the opinion that we are not a general health district, but a combined health district, and therefore the opinions did not apply.
They did try to explain that I told them we were combined, and I said no. I said I know I didn't, because right after that conversation happened, I called Mrs. Brakey and said, I just went and got our audit reports from 1999 that even back then said Geauga Public Health was a Geauga County Health Department, it's a general health district in Ohio.
Yeah.
So I said, I'm not sure why I would say that, and then go and tell someone I didn't say it, and then go say, here's the documents that say we didn't say it.
And that belief was because the health district makes up not just the townships and the village and the county, but also the city of Chardon.
Okay.
So that is why they were saying it was a combined general health district. But if you actually read this opinion from 1985, they make it clear when they use that term general health district, they're referring to a health district that encompasses the entire county. And I think that makes sense, right? Because if you had a district that, let's say our health district included part of Ashtabula County and all of Geauga, well, it wouldn't really make sense for our commissioners to have to provide space for that entire region. But the opinion makes it clear that they're talking about a health district that encompasses the entire footprint of the county, which of course our health district does. So they pushed back that they disagreed, I guess, with the opinion of the Attorney General, but that they were going to not charge us rent.
Yeah.
So
Not charge us rent this year, or did they not define?
It seems like the discussion's done.
Yeah, they said something along the lines of we'll continue to assess it in the future if the public health changes or the law. I think the public health and law changes.
It was
something.
yeah. I mean, so it's
Are they
not.
going to be trying to change the law?
I mean,
Can we get this in
I don't know.
documentation?
we have an email.
There is an email, and
Okay.
and also I'm just going off of memory. I don't think I have the email in front of me, but I think they did say that there may need to be some kind of agreement setting forth
Yeah.
the responsibilities of the parties, essentially.
So,
Which makes
do
sense.
we still have to do any manipulation to our space? Or are we still
Right.
giving anything
Where are we
to
with
IT,
space?
Well, so
or-
we don't have. I mean, that'd be voluntarily up to us.
Okay.
But we do not have to. And to add on Ms. Brady, the only thing that I mentioned to them, because the conversation was, are you combined or general? It's the only thing that I'm aware of is Bob Weisdack years ago. You say there's a contract between Chardon and with the health department, but it was back when it was a township. and then it diverged into a city, and that's when it came about, but it doesn't qualify us, it doesn't exempt us from this OAG opinion.
Yeah, I
Which is
mean,
what I told him, I said, this does exist somewhere, I'm sure, but it doesn't exempt us.
I can understand if Chardon as a city had a separate
Health
health
department, right,
department,
and we
then
absorb
that
it.
would
If they don't.
more so apply to that discussion, but I
Yes.
think, as we mentioned,
Yeah. So
Geauga
this-
County.
Miscommunication or not, I mean, I think the frustration was just the fact that they said they had these, and they still were like, you're just not that. And we kind of like,
Was
They
that
never told us they
email
had these.
from Karen Morgan or their
okay.
attorney?
that was from Jerry Morgan. That's who emailed us back.
So is the discussion then about space off, done, or are we giving some space over to?
That would be 100% up to you as a board, and I mean, I talked to, IT, and that
Yeah,
still comes
I was
back to
gonna say, how
what you
does
would want to
ADP
do.
It's-
So, I haven't had much discussion since we got this, simply because of the fact that I'm not gonna go.
well, it was
you know,
just a couple days ago.
Yeah,
so
we just got it,
was
it's not
pretty
long ago.
fresh.
Yeah, but I think as partners in the building, they've, Adam more so than I, for sure, has, built a relationship with the other tenants or occupants.
Yeah.
I mean, I think there's wasted space, and if that can be split, I think we would
Yeah,
encourage
I-
that, but I think the discussion probably is kind of off now as far as, more aggressive space discussions.
Right, space that we need, we gotta keep.
Absolutely.
Yeah.
And we need it not just for today, but we need it
Right.
for 5 years from now.
Right.
Yeah.
So if
Or
we,
even a year from now.
because
Well, we have to plan
never
for
get it
growth,
back
yeah.
if we give it up,
Yeah, if we give it up, we
we're
won't
not
get
gonna
it
get
back.
it back.
Well, and that's been the main discussion, I think, even when we talked about hot seats, was my understanding from most of you was hot seats are not really what you're looking at. You're looking at every person needs their own desk where they can have their things, they can have, they can be
Yeah.
here. And we will, with operation and maintenance, we'll likely expand some. It's not even gonna add 100 people, but we may add 2-3 people.
Yeah.
I don't have like 7 desks just sitting around. We had maybe 2, and that was like a kind of sorta it's there if no one else is in that day, but it's still tight. Like we don't.
So do
have-
we need more space?
I mean, I think if we only add 2 or 3 more people, we're fine. If we add 5 or 6, I never know what the state's gonna do, like what they're gonna push out and say it's an unfunded mandate, you have to go do this. But we don't have, as you've all walked through the space, I mean, there's hallways and there's the cubicles or offices, and that's it. There is nothing besides the lunchroom that is left. The lunchroom is pretty narrow, and it goes to the bathroom, and it's an awkward space where you're not really gonna have cubicles in there.
Yeah.
So it's not, I really don't have extra space to put anyone.
All right, and does ADP still need the supply room?
I figured I'd have that conversation after we talked today, just from the mere fact that if anything changed between this conversation, the emails and tonight, or if you said something different, I didn't want to commit to anything that we don't want to
Yeah,
commit to.
I mean, I definitely think it's necessary to keep the peace with the other tenants in the building, the relationships that we have, but be mindful that with O&M and other things, like we hope to grow as a health district,
That's what,
so.
exactly, and that's why I think we need some kind of document, legal agreement that we're keeping everything we have, and with anticipated growth of whatever, 20%, 40%, this much space, that much space we'll need in whatever years timeline.
We can do that. And that is similar to, I think there was someone asked the question earlier tonight, do we need more people and how do we do that? I think it was Dr. Rube, I can't remember. That came down to, as I mentioned last board meeting, I think the question or the statement that you all had was, A, let the levy figure out where that's at first, and then B, let's give us a documentation saying, here's why we need the person, here's what they're gonna be used for. And so we're gonna do that. So we're gonna prep that, and have that ready for you. And that would look like probably 1 sanitarian, 1 clerk. Right now, we're like at the capacity of the contract. But again, as we mentioned, when we did the contract, that did not include O&M, because it wasn't active yet. So we had said, this is just the staff you have now. The other thing that was about that same time was the House Bill 110 program. We were collecting the money and not doing the work. Now we've assigned a person to do the work, but the money's still the same as what it was. So there's not like this extra income for the extra person. So that's what makes it tough too. So Dan and I are constantly evaluating that. And like he mentioned with Christy, there's a conversation that'll happen, this week or next week as to how it's gonna go, where it's gonna be at, and what it looks like, and then we'll present probably some level of notice to all the board, next board meeting as to where we think it'll go.
Okay.
How would you guys like to see it, and we'll go from there. Because it's the first time we're kind of doing
Have we
this.
paid them anything?
No. Mm-mm.
And are there any other groups within this building that are excluded in the same way by the Attorney General? that-
That's specific to health
that-
departments.
Yeah, these
so-
are specific to health departments,
Yeah,
but
sure.
certainly,
But that's what I'm asking, are there any other groups
I don't
that
know.
are paying rent that have been excluded by?
I couldn't
Well,
tell you.
I don't know.
That'd be up-
Probably best we stay away from
That'd be up to
Yeah.
their legal team would have to just determine
Right.
that.
yeah, I would encourage them to reach out to the prosecutor's office though, and, for, you know, perhaps get some opinions. I mean, cause we've been dealing with this since when, August?
August.
Yeah.
August.
August.
So, I mean, I don't understand why the commissioner's office subject the health department and the board to what became an unnecessary exercise.
And
What,
withholding information?
yeah,
Well,
what,
and
like, what
it's-
motivated them? What were they trying to achieve? Why did they withhold those attorney general opinions if they had them all along, when they made their rent request?
I think what's concerning is we could have simply said yes.
Well, yeah, I'm
You know,
glad that.
and so I just wanna say, like, I appreciate the efforts from, like, the people who've been looking at this and the board discussion and the work that was put in to ensure that, you know, we didn't just let this slide.
I think this board is responsible and does deep dives, and that's why we didn't end up just saying, okay. I mean, we did make him an offer for $1 a square foot, but
Rescind.
Well, and they laughed at
That's
us,
playing
and that
fair.
was too high. I mean, that's the funny thing, you
Right.
know, when they asked for a
Yeah.
counter, and I think you said $1 a square foot, and they literally laughed at our faces, but guess what we're gonna pay, guys? It's $0
no, I
a
think
square foot.
this board has been responsible in investigating a lot of the issues that come our way, and we should realize that we just don't say yes to everything without investigating it, so.
And it also makes you wonder what they're actually doing with these revenues that they do collect. I mean, why do they keep needing more revenue?
And that,
Why were they trying to get revenue from us?
I couldn't tell you. I don't
You know what, it's up to those other
Right.
areas.
That chapter
To
is
make-
closed
It's
for
hard enough
us.
to
Yeah, but someone
figure
needs
this
to
place out.
discover.
Yeah,
I'm not sure I know.
we're not gonna solve all the
other
world's
exemptions.
problems tonight, but I think we did solve, we
I was
solved
gonna say,
one.
we solved
Right,
our.
and I just wanna.
Yeah, December's meeting, is world peace
Yeah.
is we're gonna tackle. I think we can handle it.
I just want to say for the record, on behalf of the other members of the board, that we're immensely grateful to both Lynn and Carolyn for the work that they did
Yes.
on this.
Agreed.
It was a yeoman's task, and it's sort of like the Browns winning last game at the end, after going through all that.
Yeah, but we heard what happened to Deshaun
Unfortunately,
Watson,
yeah.
so I don't, maybe we shouldn't make those comparisons.
We're just good at challenging.
Yes.
Actually, while it's frustrating, in my experience, every county's different. Commissioners interpret it one way, health districts interpret it another, and that's why it's 85. Nobody will go on record one way or the other, because it's just such an impact. It
Yeah.
really just hits there as almost non-existent, so I apologize not to maybe think about that earlier, but it just really, who wants to play as partners and who doesn't, that just really comes down to for the most part.
Yeah, I mean, and in the end, a lot of time and energy and, taxpayer resources were expended, and we just ended up with the status quo.
Yeah.
Well, I think that's where, I think we've all, I don't beat a dead horse here, but I think that's where the communication is what comes down. I even told myself, I apologize if I said combined, I said, but it was, when you read it, as you mentioned, you read it, we're clearly a general health district, so if you read it
Right.
and you had those for weeks or whatever, you'd say, okay, obviously they're general
Right.
health department, even if someone says opposite, it says.
The commissioners, if they really were aware of that and knew that and were aware, they could have come to us and had that clarification.
Yeah, I think it's frankly bad faith
I-
negotiations to continue those negotiations without ever referencing those documents.
But that reflects wherever they're coming from. I mean, they easily could have said that, but they never did.
If I had to guess, they probably don't remember, they don't know.
Just frustrating.
Okay, well,
All right,
we're done with that one.
everyone, should we air all our grievances about?
It's like,
I feel a lot better.
It's like
honestly.
Festivus.
And
Yeah.
you know what?
Air your grievances.
Chapter closed. That was
Yeah.
a potential financial constraint that we were genuinely concerned about, and
Yeah,
we can
that's
close
right.
that chapter and focus on, providing good services.
And Carolyn, thank you for finding the information.
Yes,
And it
thank
saves
you
you other
both.
sound bites.
Festivus tree. I hope to read
Somehow
the
that'll play
quotes
together.
about the Festivus tree. Okay, so resolution to increase certain fees, food service program, second reading.
Yeah, so this will just be the same reading of that over again. We did obviously make the two small the changes to the certain fees at the end there, we lowered
The
them.
temporary.
Yeah.
Okay.
But it's just, and there's no public here that I'm aware of to talk to them, so it's just the next reading. We'll do one more obviously in December, then put them in place.
So we don't actually have to read this. I always forget how this
No, I
goes.
think you could just read the, you
It's
know.
kind of
The
a,
resolution.
you know,
Yeah.
Board of Education, they'll say read them, but they don't read them, it's just kind of a culture
And
thing.
it's on the website, they really.
It just always, when it says reading, I'm like, do we have to? But we don't. It's a metaphorical
Story time.
reading, I
Yeah.
guess. So do we need a resolution, a motion to approve the second reading? Is that what I need?
I think a motion.
Okay.
Pretty second
The
reading.
final would be the resolution, I think.
Okay, so is there a motion to approve the second reading of increase to certain fees in the food service program?
I so move.
I second.
Moved by Dr. Rude, second by Dr. Hendrickson. All in favor? Do we need a roll call?
No, just all in favor.
All in favor?
Aye.
Opposed? Abstain? Motion carries. Moving on to new business. We got the financial reports. Do I need this whole thing in the motion, Adam? I always forget what it
No,
is.
usually just resolution to approve is
Okay.
fine.
Is there, wait a minute, so I see, when you say resolution to
The
approve?
financial reports
Okay.
resolution.
Is there a motion to approve the financial reports, resolution 23-11-07-01-01?
So moved.
I second.
Okay, so,
Do roll call.
hold on, let me just, Dr. Jones made the motion, and
Hendrickson.
Dr. Hendrickson, thank you, made the second. Okay, and this is a roll call,
Yeah,
Adam?
we'll do a roll call.
Okay.
Dr. Henderson,
Yes.
Dr. Rude,
Yes.
Ms. Roman,
Yes.
Ms. Jones,
Yes.
Ms. Brady.
Yes.
Right.
Okay. And we need to sign this, right? Is that
Yes.
how this goes? Okay.
The next one, as she's saying that, is the appropriations change that went around. So this is to,
Where's the appropriations?
it was
Did you
that,
cancel it?
maybe the very back.
Oh, this, okay, this I didn't send it.
So these are all transfers out and then one transfer to the general fund. Because of how the contract works, the general fund pays the contract for the cross jurisdictional. The goal is to transfer money out of the funds that would normally pay for those services and then put them back in the general funds. It's just it's a reimbursement cycle is all it is.
Okay.
I have sent over this document along with my explanation to Mr. Lighty at the county auditor's office. It's the first time we've done this, so I'm asking him, do my explanations, my rationale make sense? If he says no, I'll bring this back to you and we'll
Okay.
change it. Because the first time we're doing it, so I want to make sure whatever we do is the status quo that he wants from now on out.
So basically, we're signing it so that you can take it to the auditor.
Yeah, I've already sent it to him, but this will be, if he says, hey, I didn't like your explanation, I can change that
So
explanation.
conditional.
Yeah, the only exceptions to this, and I don't mean to grab this from you, but the exceptions to this are the, make sure I draw a line across here, is the FEP grant, which has not had transfers out in a large number of time. It's a deliverable-based grant, so that's when you complete a deliverable, you get paid X of dollars. That money should flow back to where your cost center is. The cost center is the general fund. And the sewage treatment systems, that's where most of our work is being done out of. But how I did the proportionate expense of it, the general fund takes up so much that one's not getting hit hard enough. And so my request to them was, I would like to transfer additional dollars out of there for the mere fact that it's not picking up, that is the highest workload in the health department. And there was about $1 million in that fund. It would take it down to not even, about where it started at the beginning of the year is what it comes down to. So those were just the two odd ones.
I was gonna say, do you want me to abstain?
The transfers you should be fine on.
Yeah, I
Yeah.
think it's fine
Changing.
because
Yeah,
it's just.
because you're not approving
Yeah.
bills or
It's up to you
expenses.
though, because
It's just transfers.
we'll have enough votes to carry either way. So is there a motion to approve the appropriations for increase, decrease as presented?
So moved.
I second.
Okay, motion by Dr. Rude, second by Dr. Hendrickson. Roll call vote?
Yeah, we do a roll call. Dr. Henderson?
Yes.
Dr. Rude?
Yes.
Ms. Roman?
Yes.
Ms. Jones?
Yes.
Ms. Brady?
Yes. All
And like I
right.
said, if for some reason they decide that it doesn't meet the criteria, I'll bring that back out to all of you. And we can always reassess that later if they would like different verbiage. The last thing is the budget. So I sent that out to everybody so you had time to review it. It's more or less 2023's budget with the cross-jurisdictional agreement. So I'm going to, so here's the budget overview, and this is, the reason I give this on the two screens behind you is what we did this time, or what I did this time is the, yes, this does not excite you. So on here, the revenue and expense, which are those two, they're, for the most part, they're evened out because I'm doing transfers out for the difference, because the revenue going in should offset the expense coming out. So we'll transfer that money out into the general fund that pays the cross-jurisdictional agreement. So it should even out. The general fund is the exception. Best case scenario, our expenses will be under our revenues by about $128,000. That's best case scenario. And when I say best case is because the for sale of property, which has our operation and maintenance in it, which is here, it's assuming that we get pretty much 100% of the NPDSs in, which with the rate of people who are just gonna, wait until their late fee gets applied, it's probably not gonna happen. So that $128,000 where the revenue exceeding the expenses is probably about zero, is where it really is. Because if you take about half of the NPDS out, that's about $150,000, so you're about zero. Now we'll get that later on when it gets tacked on their taxes and it comes in later. But we're just starting the cycle, so we're not getting the past ones in as the next ones go out. We're gonna be 1 year kind of behind, so we're kind of behind on that a little bit.
Okay.
The other hope is obviously we'll get some other things ramping up, but that's just a reality. The Workforce Development Fund, which is at the very bottom, not the very bottom, but close to the bottom here. That is a grant that we have that will pretty much offset some of the contract expenses. Now it's multiple years in there, it's not just 1 year, but we can add additional people onto it if we don't want to just use it over multiple years. Right now it covers myself, so my part of the contract is covered by that cost almost entirely. It's about
Sounds like a
80% of it.
5-year commitment from the state to build up infrastructure post-COVID, some kind of reallocated funding, so hopefully it continues, otherwise new positions and help the contract fill into that by luck. It made that money flexible for you guys, or for us.
Interesting.
I figured what it did is allow me to put more money towards sanitarians, and
Yeah.
that was kind of what we did with that money, because I'd rather have more sanitarians than anything else. I mean, nothing against our nurses and our health educators, it's just with O&M coming up, I gotta be pretty good on staffing on that.
Yeah.
The rest of them are pretty self-explanatory: sewage treatment systems and public health, emergency preparedness. It's those two. Those are kind of the majority of our revenues and expenses with that bigger. That's one of our biggest grants, and sewage treatment is where most of our expenses come out of. Food service is another really big one. We're just gonna have all the colors of the rainbow on here. So
This looks great, Evan.
yeah, looks. I mean, it's very
colorblind.
I'm good at drawing
Okay.
semi-square looking things. Food service is the other one. The transfers out and transfers in obviously are the ones over here, and they just even out. So the amounts going in are the amounts going out. We'll round these down obviously, so they're all rounded out like the ones you approved. We don't round, we just round them down. And the beginning cash balance, something I tell the budget commission every year, I take whatever our balance is as of today, I subtract 25%. And that's what I say is our cash balance. That should be overly conservative, but I'd rather be overly conservative than wrong. Because when some of these are budget, like a zero, your revenues match your expenses. If I'm under too much, then we're over appropriating what we actually are going to bring in. The only other really big change, which I'll go to the next slide that has some of those. This is the Board of Health Fund. It's just kind of a breakdown of what that's going to look like. Again, contract services being the majority of it, which is the staffing side of things. Transfers out and transfers in matching. The levy and permits for the revenue on the left side, that's the majority of the revenue. You have the state and the fees and things like that. You have the real estate tax, which is part of the levy. It's our homestead and rollback. And then on the expense side, obviously the contract services transfers out, and other expense, which is going to be a lot of stuff related to O&M, sampling costs, all those different things are all rolled up in there. I usually just do general fund, because obviously we'd be here all night if I did every single fund, we had.
How does legal fees end up being $5,000?
The what fees?
Legal fees, $5,000.
We always book that for environmental health, so if they go to court, I do that, we put a small retainer in there, and we use that, but that's more, it's not like legal like what you guys were used to.
It's not contract services,
It's
right?
very different
Yeah.
legal.
Yeah, because isn't contract services is another.
Yes, contract services is where we actually put that at.
Good question, though.
Yeah, the
You're
biggest
like,
changes.
you are under budgeting.
I
I don't know what the next year is gonna
I
look
don't know where we
like,
got this guy,
but
but
I
what we're gonna
know
give
you're
him
under
back.
budgeting.
The biggest changes that personally from my aspect have me nervous is that the Ohio Public Employee Retirement System, which is OPRS, is what we have to legally pay into for retirement. They have put out a notice that they're looking to increase the portion that we pay for every employee from 14% to 18%.
So they're looking, or they've decided?
They have not said either one. They just said it sounds like they're going to raise it. It is a matter of time. That is a huge amount of money to go 4% per employee with no exceptions. We pay it every single employee.
And that's for the year of 2024.
We don't know. I budgeted that way,
Okay.
but I don't know.
Okay.
Because all they said is we don't think we'll do it in 1 year, but we're not gonna say we're not gonna do it in 1 year.
Right.
And so.
So they
the-
sent out a mailer for.
Yeah, the other concerning part is, and I'm sure this is because they're trying to balance their budget, I get that. The other concerning part is they said they've asked for permission to make these changes on their own year by year. This is, as they said, this has not been changed in 50 years, is what their own information said.
What?
So if it has not been changed that long, and now you're gonna go up 4%, that's a lot of percent.
Yeah.
So when we look at 3% raise, and you look at health insurance increases, and you look at 4%, that's why the contract may go up to 1.5 million from 1.3. But it'd be the same thing we pay here any other time as well. I mean, that's still gonna be the same thing, because you can't get out of OPRS.
Yeah.
If you're a helper, you're paying in OPRS either way.
Yeah.
Operation and maintenance, again, I approximate 300,000. With what we have, that only may be 150,000 that comes in. But I've said we'll do 300, and then we'll assess that as we go, and we may have to reduce it. Transfers out, obviously it's based on the cross-jurisdictional agreement, that's the main reason for it. Total revenues are expected to be 3.8, expenses 3.7, and then the revenue would outpace expenses by 128,000. Again, keep in mind, this is what they call an initial appropriations change. It's we're not even through 2023. We're gonna throw it out there and see that we can get through to March when you do a whole nother one that you kind of redo it. My goal with you guys for a couple of years now has been, this should be as good as it can be, so in March we don't have to do the other one. We kind of do some quick adjustments here and there, but it is annoying, I know as a board member, from other places that I've done things with is, like, we just did this. Well, yeah, but it's an initial.
Yeah.
Well, why are we doing an initial and a final? Why did you do the final? Good question, but that's just how it works, because we don't know our final numbers until the end of the year.
Right.
So that's kind of where we're at. Again, the year will tell if things collapse and we're not bringing the revenue from our fees, things will look worse. If they do better, we'll do better. But a lot of things for us are variable costs. They're not static costs. They're very, very much variable. So that'll be kind of the dependent factor. That's the end of this, thank you. But that's kind of what our budget's at. So I just need the approval for Mr. Woolen, who's our finance person, to type everything into New World, to then have it over to the County Budget Commission by, I think it's the second Tuesday, so they can approve it, so it's ready January 1st, so we can actually start spending based on our budget that we're expecting. That's all I got.
There's a big change where you got from a year ago, with it, like, you read numbers everywhere, so.
Yeah.
It's been tough, but I think
And I think,
stay on the
to
gas.
point out, that's with your $300,000 to $600,000 cost savings. We're not 600,000 positive, we're 128,000 positive.
Right.
So keep that in mind. It's not.
Well, I mean, we were looking at a, $500,000 shortfall.
Yes, which tracks pretty close, honestly.
Yeah.
I mean, within reason, we made some changes, we had some efficiencies we made, but you're not that far off from where it looks like. So, yeah, that's where we're at right now.
What are we looking at for unencumbered cash at the end of 2024?
So on here, that's about 75% of where it is as of today. I think it's at it's this left column.
I'm looking
That's at the end of
shoulder.
that's at the end of 2023 is what.
Okay.
Now that's 25% less. I think right now we're at 4.6 if I remember correctly, or I think it's about 4.6. So it's still there, and we're not diving into it yet. But I think the thing we talked about was, as unexpected things occur, which OPERS is very much unexpected,
Yeah.
we're gonna eat into that. And then by the next cycle for a levy, we'll need a replacement. Like, it can't, I mean, knock on wood, I don't know what else could happen, but you'll likely need a replacement that will offset additional costs. And this was part of the cross-jurisdictional, was to reduce the cost as low as possible to do a renewal levy this time, and stretch it out until we do a replacement in the future, and make it cost efficient for the public, and keep their portion of what they pay us as little as possible. But again, there's a lot of what ifs in this, because I don't know what OPERS is gonna do. Do they raise it 0? Do they raise it 2, 3? The other thing that I have a significant concern on, which this impacts staffing, if OPERS, so the employees pay a portion too. So we pay, the health department pays 14% of every dollar you make, we pay to the OPERS. The employee pays 10% of every dollar they make to OPERS. 10%. So they're doing 24% per pay that is contributed to OPERS. Those are, I'm gonna guess, somewhat in lockstep. So if they go up 4, they may go up 1 for the employee.
Yeah.
And the problem is, if you come to me and tell me you're now paying 11% to OPERS, I'm saying I took a 1% pay cut. I don't care how you swing it, I took a 1% pay cut.
Yeah.
So that's another factor when you look at staffing, is how is this gonna impact staffing 5 years from now, when I'm saying, hey, OPERS is now 12%. So even though you made X then, you're really making 2% less now. And if I raise us 2%, it doesn't really track, because now you're paying 14% on top of the new 2%. So it's a never-ending defeating cycle.
I have a guess that they will go back and have to start thinking of other solutions, which has been done in other industries.
And the hardest part to sell is, so I know when I started, you might do audits for a living, OPERS was the selling point. So it was,
for public.
you're gonna retire pretty decently, you're gonna have health insurance for life, you're gonna have this, you pay for it, but it's not like private
It's
sector.
an investment though.
It is, it's an investment. You're short-term giving for long-term, hopefully end type stuff. Now, your spouse is no longer covered. You're no longer offering insurance by public entity or public employee retirement system. You pay on the open market for insurance. That the grandfather was taken out of that too, if I remember correctly. Longevity was taken out years ago. Most of the benefits have been taken and stripped away.
32 years now instead of 30.
The benefits that were there are gone, and now we're paying more for less benefits, which is becoming a very hard sell, because if someone says, hey, I can go to the private sector and make 60 out of the gate, and I'm gonna, I get some benefits, I get a little cost things here and there, and I say, well, you can make 45,000 here, but maybe your retirement in 32 years is gonna be really great, but maybe it's
But you
not.
can't predict that based on how things are going
Because
already.
that was a selling point for me. My wife's stay-at-home mom. It was, hey, she'll have health insurance, and I'm like, well, that's worth it right there. Well, that's gone. So those are all things that we have to look at that will impact this significantly. Is based on that.
There's a number of entities that have gotten rid of pensions and.
Yeah, I know right now, I'm talking like even the YMCA, they went more money in the pocket. Thus, the retirement, long-term, people are just like living in the now, this new workforce is, gonna shoot themselves in the foot, I think, but.
So it's just one of those concerns that, again, this is just an initial. It gets us through January, so we can spend based on this. And then we'll actually do 2025's budget in March for the HDAC, which the HDAC will be on.
March something.
Yeah, sorry, I need to pull up my phone.
Ours is a
It's the second Wednesday, and that is
13th?
Yes, the 13th sounds. Yes, March 13th will be the HDAC. I think I sent an email to everybody with that information, with an invite. There'll be a meet and greet. I'm going to do a dinner beforehand. Nothing big, like a pizza dinner.
Yeah.
Everybody can talk and then get ready to go in. And we'll do the 2025 budget then, and then we do an initial at the in November of next year. So we'll come back to this in February, March, and reassess this. But this at least gets us through the year. And with that, I think we all want to go home. I'm done talking.
Okay, so we need, any other questions on the budget?
Sorry, go. Yeah, I need a.
Yeah, I'm
motion,
getting there.
Okay.
I'm just making sure
Oh,
we're
rushing.
hands
After the issue
Really
last
don't
time, I
wanna
want to make
talk
sure
about
Dan's
it.
correct. I better make sure
Don't rush me. I'm
Yeah.
ready. Okay, no questions. Is there a motion to approve the 2024 Geauga Public Health budget?
I so move.
Second.
A motion by Dr. Hendrickson, second by Ms. Roman.
Do a roll call.
Roll call.
Yeah, Dr. Henderson?
Yes.
Dr. Rude?
Yes.
Mr. Roman?
Yes.
Ms. Jones?
Yes.
Ms. Brackey?
Yes. All right, motion carries. Public comment. Adam, you want to do rules?
Yeah. Everyone will get 2 minutes. I'm sure everyone's eager to speak. And we just ask that you keep it cordial and polite, and that we treat each other respectfully. And with that, I'll go around the room to the lovely couple in the back.
Pass here.
Okay. On this side, Mr. Moreno, go ahead.
Okay.
Oh, time's up.
All right. So I would just like to talk about, there's a certain septic system that has had a premature failure rate. I know a lot of residents have taken out that system and installed a new system. And I guess there's some issue whether it's required to have an alteration permit. And so some people are paying for it and some people are not, I think the board has been gracious enough in crediting some of them. So will the other homeowners get credited, or how is that work? I think there's about, 7 or 10.
I'm going to pause your time just so you can talk. I think that's the thing I brought up last meeting was the cyber systems we had credited to previously. Those were
I can say that.
yeah, I'm gonna be open because
It's a known issue.
that was a specific issue that we addressed with 2 homeowners at a time. Those were newer systems put in. They failed. Printer off the badge number correctly down. I didn't say failed. Sorry, they didn't pass inspection. But I don't remember all the details in those either. I guess. Do you remember?
Not off the top.
They have a lot of
There's
shortcomings, I
There's
guess.
some more to play.
Yeah.
I mean, I think probably.
Without the file in front of you,
Have to
there's some
evaluate.
longer.
It is a while ago, and legal head at that point said really the homeowners need to do their own legal counsel. But that was brought up, a homeowner stopped in last month, maybe at the end of the month, and had asked, he said, hey, I'm being told that you guys do this. I said, I don't have approval without board approval to do that, and I can't just write an open checkbook. I don't know where the extent ends at. So, and if the system's 10 years old, you guys are okay with it. If it's 1 year old, you're okay with it. So based on what you guys want to think about
Yeah.
or
If you
consider.
want to-
A blanket consideration versus case by case for this specific issue.
Yeah, I
And
think,
I think it's important, the homeowner did pay for the permit for the initial installation, and to the homeowner's credit, that wasn't, I don't think, their fault that, the system didn't work properly. But they are being positive, I think, in recognizing that there's a problem and putting in a new system, so.
Yeah, I think Dan, we could put together an impact summary, or whatever, white paper on it to see what would it look like if it's advised or not.
We need that before we can respond.
Okay, so we'll get that together and have you guys for December,
Cyber.
and go through it and see what you guys think in December.
yeah, I think when I asked last time, I was told there was wasn't there like 250 systems we
Yeah, I wanna say
thought?
it was
It wasn't a small number.
I want to say it was like
Really?
200, yeah.
That's,
Dan, cyber's like 200, I think that was,
Uh,
that was our random
Yeah, so
spitballing.
that's what we looked
I
at.
have
Okay.
to double check on that.
Yeah.
too.
It wasn't just 7.
Yeah, that's what
yeah,
I'm worried
I wish
about.
it was.
I-
That'd be an
yeah.
easier decision to
Right.
make.
Yeah,
Yeah.
200's probably, I think that sounds about
Yeah.
right, if I remember.
yeah.
Off the top of my, that was off the top of our head, but we can put an impact type statement together, so.
So the other thing I'd like to talk about is, and I appreciate everything that the board and the department's done. I think the consumer seems very happy with how things are progressing. And again, I think it's important, this board is just not a rubber stamp, if something comes in front of them, like Lynn says, you investigate it and you in this respect regarding the commissioners, I think you're gonna save a lot of money, so that's good. But with that being said, when we got rid of the for sale of property, Ohio Realtors and Lake Jog Association of Realtors is offering their assistance in anything that we can do to help implement the O&M program. So I don't know if there's something that we can do. We have funding available. I just had some of these. I don't know
Right.
if you've
No, I
seen
need a
these. I
magnet.
don't know if I got this from, did I get this from you, Dan, or from EPA? But, I mean, it's kind of neat because it's a magnet, and when they,
And I apologize to cut you off, Rich, for the 2 minutes.
okay. But anyway, so if you consider that, I'd appreciate it.
Yes,
Whatever
we
you
will.
need. All right.
Mr. Perino also looked at a lot of items for you on the board during his time to get us to where we're at today. So, thanks again for the
Thank
time we
you.
worked together,
Mhm.
and still work together.
No
Really
problem.
appreciate it.
Thank you.
Okay.
And for those who don't recall, Mr. Prano is the secretary of the Friends of the Public Health Department, which is where the levy came from. Is he was out there handing out signs and
Yep.
shaking hands and kissing babies and all that good stuff.
He did the League of Women Voters Forum too, which is
Yeah.
kind of a
Yes.
high pressure
Did you?
situation, and he He did, it was based on school district, he did it at every single
Oh my
school
gosh.
district.
I
He
didn't
went
know
up
that.
there, did his piece, answered questions from the public. So that's a like stressful situation, and he handled it very gracefully.
Depends on the white.
Thank you.
Would you like to
Ms.
comment?
List.
I just want to say thank you very much for all the investigating, especially Karen, for what you've done. In regards to the rent from this place, I hope the veterans do the same thing. But I just wanted to say thank you guys for digging into stuff, because I can't tell you how many board meetings I go to where they rubber stamp everything and they just do whatever somebody wants, whether it's, you know, one person on the board or I don't know what it is, but anyways, I just want to thank you, because you are a unique board in that you don't do that. And I wish that more boards would take note and follow your example, so, thank you.
Nice comment.
Anastasia. She's like, I can't follow that. No.
So Chad,
She's gonna complain about the cookies.
I demand better cookies. As always, the camera guy.
No cookies on board.
He said no.
No comment about the cookies either, man.
Slacking.
Alright, so we don't need an executive, do we?
We do not.
Oh,
It was on there in
perfect.
case we had to have it, but we do not need one.
Alright then, let's adjourn this meeting at 6:35 PM.
So you do your homework, you get out early, that's all.
Right?